Right. We now come to the first statement. I'm sure there must be something left to say. Secretary of State, West Streeting.
Thank you, Mr. Speaker, and a Happy New Year to you too. And to everyone across the House. Mr. Speaker, with your permission, I would like to give an update on health and adult social care reform. I want to start by paying tribute to the NHS and social care staff who've worked throughout the Christmas break, including staffing our hospitals, ambulance services, care homes and call centres on Christmas Day and throughout the new year. I know from visiting hospitals and residential care homes in the southwest of England, in Essex, in London, in South Yorkshire and the northwest in the past 2 weeks, the extent of the pressures they are dealing with. They are going above and beyond to keep the NHS standing, to provide people with the social care they need, to give patients and care users the best care they possibly can against the most challenging backdrop. We have seen more than 3 times as many patients hospitalised with flu this winter compared to last year, in a service with no slack left to give. Since coming into office, the government has been doing everything we can to prepare the NHS for winter, including ending the resident doctor strikes, so this is the first winter in 3 years when staff are on the front line, not the picket line. The Chancellor made an additional £1.8 billion available in year to fill the black hole left by the previous government, and we introduced the new RSV vaccine to protect more than 1.2 million people against the virus. But, Mr. Speaker, I am not going to pretend for a second that the experience of patients this winter is acceptable. The government has been honest about the state of the NHS since the election, and we will continue to be. The NHS is broken, but not beaten. It will take time to fix, but it can be done. That's why the Chancellor made an additional £1.8 billion available in year to fill the black hole left by the previous government and to enable us to deliver on our first steps to cut NHS waiting times. It is why we are undertaking fundamental reform, and it is why we are acting on social care. Mr. Speaker, these are the honest facts. The social care system in this country is failing. It is leaving hundreds of thousands of disabled and elderly people without the care they need. The failure of social care is piling enormous pressures on the NHS. In November, more than 12,400 hospital patients a day were well enough to leave but had to stay overnight because they weren't able to be discharged. We have an ageing society. By 2050, there will be 4 million more people aged 65 and over in England. If we do nothing, the social care costs are expected to double over 2 decades. And of course, Mr. Speaker, there is plenty of blame to go around. In 2009, when Andy Burnham established cross-party talks on social care, the Conservatives pulled out and leaked details of the talks to attack Labour. In 2017, it was Labour who torpedoed Theresa May's proposals. And in 2022, the Right Honourable Member for Richmond, as Chancellor, delayed Boris Johnson's cap on care costs and then defunded them as Prime Minister. There hasn't been a shortage of good ideas in the past 15 years, but a lack of good politics. It is time all of us across this House do things differently. I've written to my opposite numbers and the leaders of all UK-wide parties represented in this House to invite them to help break out of this cycle of political failure. I hope all of us across this House will put aside our ideological and partisan differences and work together on this to finally find a way through to a long-term plan that can build the broad consensus we need. We don't need to agree on everything, but in April we will launch an independent commission on building a national care service. I'm delighted that it will be headed by one of our country's leading social reformers and Whitehall's greatest doer, Baroness Louise Casey. Yeah. Baroness Casey has served Labour, Conservative and Liberal Democrat governments. She is a trusted, independent figure who will take views from all parties and, crucially, the public, as she seeks to build a cross-party and national consensus on the future of social care. Crucially, she will get things done. Her first report will be published next year, making a series of recommendations that can be implemented straight away throughout this Parliament, and her final report will come later in this Parliament. In the meantime, we are stabilising the social care system today. We have legislated for the first ever fair pay agreement for social care to tackle the workforce crisis, the 131,000 vacancies we see today. In the budget, the Chancellor provided the biggest increase in carers allowance since the 1970s, worth £2,300 a year to family carers, and an extra £3.7 billion for local authorities. On Friday, I visited the home of Keith and Elaine in Carlisle. I saw firsthand how extended doorways and the installation of accessible kitchen and bathroom facilities have changed their lives, thanks to the Disabled Facilities Grant, allowing them to live with renewed dignity, independence and happiness. That's why I announced last week the immediate release of £86 million through the Disabled Facilities Grant to provide an extra 7,800 home adaptations before April, changing the lives of thousands more disabled people for the better, just like Keith and Elaine have experienced. Yeah. And we're not hanging around on reform either. We're introducing new standards to help people who use care, their families and providers choose the most effective new technology as it comes onto the market. We're joining up care and medical records, so NHS and care staff have the full picture they need to provide the best possible care. And we're training care workers to perform more health interventions to help people stay well and at home. A lot done, a huge amount more to do, and if this House gets it right, the best is yet to come. Turning now to the elective reform plan the Prime Minister has launched today. The government inherited NHS waiting lists at 7.6 million. The NHS standard that patients should wait no longer than 18 weeks for treatment has not been met for a decade. Shocking. Millions of patients are forced to put their lives on hold while they wait. In his investigation, Lord Darcy listed the causes of this crisis: the undoing of New Labour's reforms, the disastrous top-down reorganisation, slashing GPs and community health services, all of which has led to a dramatic drop in hospital productivity. Lord Darcy has diagnosed the condition. Now this Labour government is prescribing the cure. In November, the Prime Minister set out the government's plan for change, a plan to dig this country out of the hole it was left in, an act of resistance against the status quo of managed decline. It committed to cutting maximum waiting times from 18 months today to 18 weeks by the end of this Parliament. Today, we are setting out how we will hit that ambitious target so that the NHS is there for us when we need it once again. This will demand faster improvement than even the last Labour government achieved. That means doing things differently. It had to be a plan for investment and reform. Investment and reform is what Labour promised before the election. Investment and reform is what we are delivering now. Yeah. Our elective reform plan will cut waste and inefficiency, ramp up the number of appointments, scans and operations the NHS performs, and give NHS patients greater choice, control and convenience. Mr. Speaker, any patient using the NHS can see the waste and inefficiency in the service when they use it. Staff feel it, holding them back every day. When the government announced significant investment in the budget, I said it would come from reform, so every pound would come with reform, so every pound was well spent, and here it is. Resources will be diverted from hospitals to GPs to get hundreds of thousands more patients cared for faster in the community. Patients will have the choice of whether they want or need follow-up appointments, saving 1 million pointless appointments a year. GPs will be able to directly refer patients for tests and scans, cutting out the middleman and speeding up diagnoses for patients in a wider range of conditions. For years, restaurants have been texting customers reminders of their bookings, giving them the chance to cancel or rearrange to cut down on no-shows. The NHS will learn from the hospitality sector, do the same for patients, and cut around 1 million missed appointments every year as a result. In opposition, we said that investment in new, more productive ways of working would make a significant dent in waiting times. Today, we are announcing 17 new and expanded surgical hubs to run like Formula One pit stops and bust through the backlog. Community diagnostic centres open at evenings and weekends, so patients don't have to take time off work for their appointment and they can get diagnosed faster. We're rewarding trusts which cut waiting times fastest with extra capital investment as an incentive. And we are publishing a new agreement with the independent sector, the first of its kind for 25 years, to cut waiting times. Mr. Speaker, over the past 14 years, a two-tier healthcare system emerged in this country. People who can afford it are increasingly going private to skip the queue, while those who can't are left behind. Working people are going into debt, and others are running fundraisers to pay to get an operation. These are stories that belong in pre-war Britain. They should shame the party opposite. I am determined to end two-tier healthcare in this country so that whether you are the richest or poorest person in Britain, you get timely, quality treatment free at the point of use. This new agreement will see more NHS patients able to choose to be treated in a private hospital where there is capacity, paid for by the state. More capacity will be available for people in working class areas of the country and for women stuck on gynaecology waiting lists. Where we can treat working people faster, we will, and we make no apology for doing so. Because working class patients in this country deserve the same choice, control and convenience as the wealthy expect. Indeed, as we all expect from other apps and services we use every day, but not in the NHS. That is why we are also modernising the NHS app to put patients in the driving seat for their own care. If customers can choose when their Deliveroo meal will arrive and be kept informed until it is dropped off, why shouldn't patients be afforded the same service by the NHS? With this plan, they will be. Patients will be able to manage their appointments, book tests and scans, view results as soon as they are ready, choose where they will be treated, cut down on letters that arrive in the post after the appointment, and give power back to the patient. Mr. Speaker, in the past 6 months, we have ended the resident doctor strike, invested billions more in our health service, the biggest investment in hospices and end-of-life care for a generation, investment and reform in general practice to fix the front door to the NHS and bring back the family doctor, and we've started to get NHS waiting lists falling. This plan for investment and reform will press down harder on the accelerator, change our NHS and change the experience of millions of patients. It will put the NHS on the road to recovery, and I commend this statement to the House.
Shadow Secretary of State Ed Argar.
Thank you, Mr. Speaker, and a Happy New Year. And I'm grateful to the Secretary of State for his typical courtesy and early sight of his statement, as well as for his call last week, and indeed earlier sight than I'm normally used to, because I was able to read most of it in the media before coming here, which was not unhelpful. May I also take the opportunity to echo the Secretary of State in his comments in thanking and paying tribute to NHS and social care staff up and down the country, in my own university hospitals of Leicester NHS Trust, to GPs, and indeed, I'm sure, to all those in Chorley Hospital, Mr. Speaker, for all that they have done over the festive period. They work full on, day in, day out, every day of the year, but they will feel particularly the pressure over the festive period when they're not able to spend it with their families. So it's important we, across this chamber, share our recognition of that. Mr. Speaker, the Secretary of State set out very clearly the challenges facing the system. We all know that the system must work well and must work as a whole, both clinical care, the NHS and social care, for our health and care system to function. So it is right that his statement today addresses both of those issues. He also highlighted the challenges we face as a society, an ageing society. We're all living longer, which is a good thing, but that brings challenges of care and more complex needs as we all get older. And of course, that comes atop the ongoing challenges of the legacy of the pandemic, which are still with us in many ways. Now, the Secretary of State in his comments referred to previous reforms. He did opt, I'm afraid, not to reflect another point in Lord Darcy's report, which was his positive remarks about our 2022 reforms, which the Secretary of State knows I took through this House and which laid the foundations on which he is now able to build. I'd also highlight, though, that in the sense of seriousness and cross-party work we've done, certainly on the social care aspect of this, the challenge is very real, and we must address both challenges swiftly. Before turning to the long term, if I may turn to the immediate and ask the Secretary of State a few questions about winter and the challenges the NHS is currently facing. We heard from the Minister before Christmas about the work being done for extra coordination and new data, but what extra capacity in terms of extra beds specifically for the winter period has the Secretary of State put in place to help ease pressure? What additional capacity has he put into A&E? We always recognise winter was challenging and always put in extra resource and extra support and extra capacity, so I'd be grateful for an update on that. I'd be grateful for an update from him on the pressure being felt in respect of the quademic of various challenges being faced by the sector, and also how many critical incidents have trusts declared since the 1st of December. And I'd also be grateful if he could update us on the pressures being felt in response to them in the light of the winter weather, and indeed in my region, in Leicestershire and across the country, the extensive flooding we've seen in my Melton and Syston constituency, but in many others, and the impact that's having on our ambulance services in particular. Turning to reform and elective recovery, I want to support him where he is doing the right thing, and it's important that he is keen to press a bold and innovative agenda. It's in the interests of all of us that he is bold. But I do call for the Secretary of State to be more ambitious. Now, they're not words often spoken about him, and I suspect certainly not in number 10, but I do call for him to be bolder and to go further. Because as with so much from the current Prime Minister, with multiple relaunches of previous announcements, what we see here is yet another relaunch of a previous announcement. The difference being, it was the former Secretary of State, Sir Sajid Javid's announcement from 2022, which has been reheated and re-served up today. In respect of CDCs, we delivered 160 of them with 9 million additional appointments. How will the Secretary of State's plan go beyond that? We delivered 18 surgical hubs. How will he go beyond that? We worked with the independent sector to allow it to be used to help tackle the backlogs. We improved technology and the kit available with £6 billion of investment. The NHS app was created during the pandemic and was designed and redesigned by the Right Honourable Member for North East Cambridgeshire and his team to allow for regular updates. So again, it's right it's being updated, but how is he radically changing what was already in place? And I certainly, and I suspect others, already received text updates on treatment we're due to receive and on appointments. So my challenge to the Secretary of State is, what is he doing that is fundamentally different? But the key underpinning point from the then Secretary of State in his plan was around workforce, because none of this can be delivered without the staff to do it, to deliver those tests and to interpret them. The then Secretary of State set out his plan to grow the workforce. We have record numbers of doctors and nurses and increased medical school places. So what is the Secretary of State's plan to grow the workforce to actually deliver on his ambitions? Turning to social care, he will know, because I have said it publicly, I will work constructively with him and with the Commission, because he is right to highlight the challenges that governments of all complexions have faced, be it under Tony Blair and Gordon Brown, a Royal Commission, 2 Green Papers and a CSR didn't deliver. Similarly, the reforms Theresa May brought forward again didn't deliver on it. We proposed reforms which were due to come in this year, and the Chancellor scrapped those, but I think it's important we look to the future in how we can work constructively together on this. So I say to him, we will enter into those discussions with him and with the Commission in that spirit. But I do challenge him on the speed and the pace of his ambition. The sector is under pressure now, added to by the national insurance increases, which they do not yet know how they are going to pay for. The real challenge for him is, why 2028? The sector is crying out for a faster pace. Be bolder, be more ambitious. We will work with the Secretary of State to deliver that. A year plus to deliver a diagnosis. We know the challenges. He's had 14 years in opposition. He should have a plan now. So I say, Mr. Speaker, in concluding my remarks, we will call out the Secretary of State where he gets it wrong or where he simply re-announces what's already happening. But where he is right, and on his approach to social care and wanting to find a way forward, he is right, and we will work with him constructively for the good of patients and for the good of all of our constituents. Many already feel very let down by broken promises from the party opposite just over the past 6 months. So I say to him, please do not break this promise. Work with us and deliver the change across this House that our constituents all expect and deserve us to work together to deliver.
OK, Secretary of State.
Thank you, Mr. Speaker. Can I just first of all say, it seems to be the Conservative line across the board now that says, you had 14 years in opposition. Why haven't you sorted it all out in 6 months? Can I just gently say, you had 14 years in government. It'll take longer than 6 months to clean up your mess. Or the party opposite's mess, I should say, Mr. Speaker. Certainly not your mess. But honestly, I do think that Conservative contributions to discussions in this House might have more credibility and a stronger landing zone if they did at least acknowledge their part in the deep mess and malaise that they created in the last 14 years. Nonetheless, beginning on social care, can I welcome very sincerely and warmly his party's support for the Independent Commission? I think it is important, as a matter of principle, to try and establish in broad terms the level of consensus about what social care should look like and how it should be delivered to meet the needs of older and disabled people in the 21st century, with changing demography, changing challenges, changing pressures and a changing pace of technology, as well as the question of balance of provision between the individual, the family, the state, and the balance of financial contribution in paying for social care between the individual, the family, the state. Of course, those are issues that will inevitably be contested across the party political divide from one election to the next. But just as we have had broad consensus on the National Health Service since 1948, just as we have had broad consensus on state education, actually, since the Rab Butler reforms, just as we have had broad consensus on most of how public services should be delivered for much of the last century, we should try and establish the same consensus on social care. Not to say we should agree on everything, but we should agree on as much as possible, because the truth is, whether it was Gordon Brown and Andy Burnham in 2010 or Theresa May in 2017, we can see how the extent of party political wrangling and rancour and sometimes opportunism has sunk well-meaning attempts to grasp the nettle of reform. And on the question of pace, just to reassure people, in the first 6 months, we have already legislated for fair pay agreements, delivered the biggest expansion of care allowance since the 1970s, injected immediately funding into the Disabled Facilities Grant, 86 million, and another 86 million to follow from April, 711 million in total over the next year, as well as the increased spending power for local government in the budget and £880 million for social care specifically. So with respect to people saying go faster, I would just urge people to bear in mind that's quite a lot we've already done in 6 months. We don't pretend that we've solved all the problems, not nearly solved all the problems, but that's not a bad start for a government that's determined to show that we understand the pressures today in social care and are willing to deliver. And on the deal-not proposals, yes, they were very good technical responses to a question that was set for Andrew Deal-not by David Cameron. But we should reflect on why it is that every single Prime Minister since Lord Cameron, including Lord Cameron himself, did not implement those reforms because there has always been something else that's been more pressing and urgent in health and social care. And that's why Baroness Casey, I'm sure, will consider the deal knot proposals alongside all of the other challenges and potential solutions to the wider issues in social care. But we are determined to respond at pace. That's why the first phase of Casey's commission will report next year, and that will set out an action plan throughout this Parliament, and I hope we can achieve broad consensus on those actions too. Turning to the winter situation, he asks what capacity there is. There are 1,300 more beds this year than last year, according to the latest figures. Of course, those figures flex up and down depending on pressures, but just to say, these are enormous pressures. The number of beds occupied with flu is much higher than last year, somewhere between 3 to 4 times as many beds occupied by flu patients this time than last year. The number of adult beds closed due to norovirus has reduced for the latest figures, but is still above last year when 485 beds were closed. The latest figures show 666. And on acute beds, as I say, 1,300 more this time this year than last year. Ambulance responses. We've seen many more call-outs this year, a 3.8% increase in emergency admissions compared to the same period last year, the highest November on record for A&E attendances in November. And I've just got to say, Mr. Speaker, ambulance response times nowhere near where we would want them to be because of the enormity of the pressure. That's why I've been out on the front line, including over the Christmas period, not just looking at what we can do to mitigate against challenges this year, but we are already beginning to plan for next year, because I want to see year-on-year continuous improvement in urgent and emergency care. And finally, Mr. Speaker, turning to the challenges on the reform plans we are proposing and setting out today. On workforce, one of the reasons why we have emphasised the importance not just of investment but also of reform is to free up the staff capacity that we already have in the NHS to make best effect. That means dealing with the number of non-attendances by sending reminders to patients and giving them ease and convenience with rebooking. It's why we are getting rid of unnecessary low clinical value outpatient appointments with the consent of patients in every single case. It's why we are asking general practitioners and funding general practitioners to do more to manage cases in the community, with more advice and guidance, working with colleagues in secondary care to ease pressure on hospitals. It's the reform plan today, I think, that answers the challenge we've heard from people across the NHS about how do you tackle the elective backlog without doing it at the expense of general practice or urgent and emergency care or community care or social care. The truth is this is a systemic challenge, and we will only be able to deal with the challenge in the elective backlog by also acting on urgent and emergency care, on general practice, on community care and on delayed discharges in social care. So we are taking a system-wide approach to meeting this essential target. There are a number of things that are different from the previous government. For example, just on the deal with the independent sector, giving them the stability and certainty of working with this government gives them the confidence to open and invest in new capital, estate and new kit, particularly in parts of the country which are relatively underserved by the independent sector. We have insisted that they do it with their own staff and resources, and actually put their money where their mouth is in terms of training new staff as well to deal with some of the pressures there. That's how we will ensure that we won't be taking Peter from the NHS hospital in order to treat Paul up the road at the independent hospital. Finally, Mr. Speaker, and I'm happy to take more questions on the detail of the plan, he asked what is different from 2022. In fact, I think he asked me to commend my predecessor, Sir Sajid Javid, for his work in 2022. In the bipartisan spirit of the new year, let me commend the work that he did and Sir Sajid Javid did on trying to undo the disastrous top-down reorganisation of Lord Lansley. That was a very good thing to do. And finally, Mr. Speaker, there will be a very big difference between this government and our Conservative predecessors. That will be real delivery, shorter waiting times and an NHS fit for the future.
Deirdre Costigan.
Thank you, Mr. Speaker, and can I wish you and your team a very happy new year. Can I ask the Secretary of State if he would agree that his plan to transform adult social care services has already started with Labour's Employment Rights Bill, ensuring that social care workers will get fair national pay and conditions and increased access to training and to progression? And would he further agree with me that we will never have a quality social care service in this country if we don't value the people delivering it properly, as this Labour government intends to do?
Secretary of State.
My honourable friend is absolutely right. First 100 days, and the Employment Rights Bill contained provisions for new fair pay agreement for care workers. And who better to be leading the charge on that than the care worker turned Deputy Prime Minister, my right honourable friend?
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr Speaker, and a Happy New Year to you. Can I add my thanks to those of the Secretary of State and the Shadow Secretary of State, to all of those who worked in our health and care services over Christmas and the New Year. Our health and social care system is in crisis, so Liberal Democrats today are broadly supportive of the measures that the government has announced. However, we do have some concerns, not least that action on social care may arrive too late, and that the focus on elective care may come at the expense of emergency care. Now, Liberal Democrats have long been calling for cross-party talks on social care, and so we're glad the government has listened, and we look forward to working constructively with the Secretary of State and the other UK-wide parties as the review develops. However, carers, care providers and councils are on the brink of bankruptcy, and they need solutions right now and not in 3 years' time. And there have been many such reviews, and what is needed now is action on the recommendations that they've made. It's also absolutely crucial that waiting times for elective care are radically cut down, and so the action announced today to speed up scans and treatment is very positive. A waiting list of more than 6 million people is one of the worst legacies left behind by the Conservatives. But those legacies also include overcrowded A&Es and unacceptable ambulance delays that can mean the difference between life and death, as people in North Shropshire know only too well. Emergency care is under immense pressure at the moment. One visit to Shrewsbury Hospital will demonstrate that. And we need bold action if we are to ensure that this is the last ever winter crisis. As the MP for a rural area, I hear every week from constituents suffering because of the crisis, so they will be following today's developments closely. Many of my constituents are elderly, far more than average. They are the people most likely to need the NHS and the most likely to be digitally excluded. According to Age UK, around 29% of people aged 75% and over don't use the internet, and around a third don't have a smartphone. They deserve as much choice and control as everybody else. So can the Secretary of State outline how those without access to the NHS app will be able to benefit from the same options and information as those who do have access? Will the Secretary of State consider fast-tracking the social care review so that the sector can get the urgent attention it needs? Will the Secretary of State commit to rescue our emergency services by supporting Liberal Democrat calls to make the NHS winterproof with a new winter task force that builds resilience in hospital wards, A&E departments and patient discharging? And finally, will he define what is a working class area? Because the health and care crisis is acute in rural Britain, and we cannot afford to be left behind. Thank you.
Thank you, Mr Speaker. Let me just take those points in turn. Firstly, just to thank the Liberal Democrats for their support for the Commission, and actually for the way in which their party has put the issue of social care much higher up the political agenda, particularly during the general election campaign, which I think has been very helpful to me in the last 6 months, and to the government. And we look forward to working with the Liberal Democrats to build as broad a consensus as we can on the solutions to the social care crisis. Of course, we have already hit the ground running in a number of respects, as I've mentioned already during this session, including the biggest expansion of carers allowance since the 1970s. And on investment in health and social care, I would just point out that the £26 billion the Chancellor allocated to the Department for Health and Social Care alone at the budget dwarfed what the Liberal Democrats promised in their manifesto. And I know that not all of the decisions that the Chancellor and the Government has made in the last 6 months on funding has been popular in terms of raising the investment desperately needed in our public services. But I say respectfully to people who disagree with the decisions the Chancellor has taken, they need to spell out which services they would cut or which other taxes they would increase, because those are the choices. We've made our choices, we stand by them. What people can't do is welcome the investment but not say how they would fund the investment if they oppose what we have done. And as I say, the Prime Minister, the Chancellor, the entire government has been willing to make unpopular choices in the last 6 months because we believe they are the right choices to get Britain out of the hole it was left in by our predecessors, and people will not thank us for resorting to the short-termist, sticking plaster, government by gimmick politics that plagued this House during the last Parliament. On some of the other issues she mentions, urgent and emergency care, we will be coming forward with further proposals on urgent and emergency care reform. I want to take the best of the NHS, the rest of the NHS, whether it's here and treat, to do over-the-phone triage with community responses that would be more appropriate and faster often than ambulance response times, and getting ambulances and ambulance handovers speeded up at all of our hospitals with the release to rescue approach we've seen working successfully in some parts of the country, but we need to see consistently rolled out. She talked about patient choice for those who are digitally disconnected or don't want to organise their lives around their smartphones. That's why I believe very strongly in choice, different courses for different horses. If I'm booking my appointments over the phone, that frees up the phone line for people who want to get through and would prefer to do their business and book their appointments over the phone. She asked us to fast-track the social care work. Well, the first phase of Louise Case's commission will report next year, but of course we're willing to talk to parties across the House about how we move forward. She urges us to set up an urgent and emergency care task force. Let me just reassure her that myself and the Minister of State for Health have every single week, and often more frequently, convened health and care leaders virtually and in the department to keep a grip on what is going on, to provide as much central support as we possibly can, to respond to crises as they emerge, and if only it was the case of setting up a task force. We already have one. What we need to see is sustained improvement from one year to the next, and that's what we're determined to deliver.
Can I suggest we help each other with short questions, and certainly going to get very quick, punchy answers, I'm sure. Ben Coleman will be a good example.
Mr. Speaker, I take that personally in a positive way. Happy New Year to you. Thank you so much. It's a very encouraging statement. It's great to start the new year with some good news and to be so clear that we are keeping our promises as a government. And it's also very good that we're spending the time necessary to create this cross-party consensus on social care while keeping the show so firmly on the road. Carers are going to be supported to carry out more health tasks, and they're already doing it in my constituency. They do wound dressing, they do medicine management. The problem is they don't have any possibility of career progression, Mr. Speaker. I'm sorry, I forgot your initial encouragement. I'll bring this to a close. And so, Mr. Speaker, would you not agree with me that as carers are encouraged to do more health tasks, they need proper opportunities for career progression, even within the NHS, in collaboration with local authorities?
Secretary of State.
Brevity was not my honourable friend's New Year's resolution. But you're encouraging, Mr. Speaker, it is mine. We are going to provide more training to care professionals to deliver a wider range of tasks in the home, making better use of their skills and the career progression he describes. And crucially, that career progression has to be in status and in pay, and that's what we will work with the staff to deliver.
Fire of the House, Sir Edward Leigh.
I welcome the consensual part of the Secretary of State's statement. I wonder whether we've been entirely honest with the public about the sheer unaffordability of the cap proposed by Dilnot. And I don't absolve my own government from this. Maybe we should start telling the truth to the public. I wonder whether the Secretary of State thinks that we need a new social compact on bringing in social insurance so that people can plan for their entire life, and they will know that they will have to pay more in taxes during their life for their old age, but they at least will have certain rights.
I think the honourable gentleman is right to say that we do need a debate as a country about the balance of financial contribution between the individual, the family and the state. I well understand why David Cameron was so concerned about the issue of catastrophic care costs and people having to sell their homes and to pay for their care, and the problem he was trying to solve. But we've seen with every government since, that issue is not seen as urgent as others. That doesn't mean it doesn't matter, and it doesn't mean we shouldn't consider it as part of the Casey Commission, but we need to consider all of these issues in the round, and as much as we can build a consensus, not just in this House, but throughout the country, about the balance of financial contribution, what's fair, what's equitable and what's sustainable.
Jem Craft.
Thank you, Mr. Speaker. Just before Christmas, one of my constituents visited my surgery and really gave me pause to reflect on the massive impact on loved ones who have people in the social care system, and how that quite often is lifelong. It can be devastating, impacts their ability to work and their ability to live healthy and fulfilling lives. Does the Secretary of State agree with me that hopefully this commission will lay the foundation to make sure that there is a real change that happens, so that people in the social care system and their families are able to live their healthy, fulfilling lives that they deserve?
I strongly agree with my honourable friend, who's done much already in the last 6 months to champion the issue of social care, whether people are in residential care home settings or whether we are doing everything we can to make sure they can stay in their own homes. Everyone deserves to live comfortably, well supported, with independence and dignity. That's why the step we've taken, particularly through the Disabled Facilities Grant, I think will be immediately impactful to thousands of people across the country in just the next 3 months. We've got so much more to do, and that's why I'm genuinely excited by the work of the Commission.
Chair of the Select Committee, Layla Moran.
Thank you, Mr. Speaker. Given that the Health and Social Care Select Committee's first inquiry is social care at the cost of inaction, we welcome any action. But as the name suggests, we are concerned about how long it takes, because every year that there isn't reform, that costs money to the NHS, but also the wider economy and to people's lives. We've got Andrew Dilnot in front of us, in fact, on Wednesday, and it's 14 years since his report. It's been put into legislation twice. Now, I ask the Secretary of State to be specific here. What is going to stop us in 15 years' time not having Louise Casey in front of the next iteration of a committee? What's going to be different this time that we get that cross-party consensus and it sticks?
It's a great question. Firstly, I shall put my shin pads and crash helmet on if Andrew Dilnot's in front of a select committee this week. Look, I can well understand his frustration. He's a decent man who did an excellent piece of work, and it must be frustrating to see one government after the next not implementing something that was welcome. The issue for us as an incoming government was that the money wasn't there, and even if it had been, the system hadn't been set up to deliver for the October 2025 deadline. And then in terms of other immediate pressures, we chose to act in other areas because we saw those needs as more pressing. That doesn't mean for a moment that I don't think that Andrew Dilnot's work is still not valuable. I think it might well be, but I think we've got to consider the issues in the round and come up with a clear and sustainable plan that we can stick to. In terms of why would Casey be different, why would it work, that's where I think as much political consensus around the House is really important. And I think it's why the national consensus and getting the public on board will be really important. And anyone who has ever met Louise Casey will know she is a very difficult woman to say no to. And I have no doubt that if Louise Casey says something needs to be done, this government and future governments, whoever's in government, will make sure that it happens.
Dr. Rosena Allin-Khan.
Thank you very much, Mr. Speaker, and Happy New Year. Just yesterday and over the Christmas recess, I was working shifts in my local A&E in St George's in Tooting, and up and down the country, doctors like myself were seeing older patients and disabled patients who were not being able to be discharged from hospital due to a lack of good, affordable social care in the community. So I welcome the steps outlined today. What I would say and would ask the Secretary of State is, due to the fact that there are imminent pressures, what steps has he outlined, or will he outline, to actually ameliorate those pressures sooner?
Firstly, can I thank my honourable friend for the work that she does on the NHS front line, particularly when Parliament is in recess, but actually often alongside our own her everyday work as a member of this House. It is truly above and beyond the call of duty, and she sees firsthand the pressures and failures that the NHS is experiencing. She's right about delayed discharge. In fact, when I was at Bernard Care Home, residential care home in Carlisle last week, Not only did I see wonderful ensuite room facilities with people in intermediate NHS care, NHS-funded beds in those care homes, they were in better settings at half the costs of the hospital bed they left behind. So delivering better care in the right place at the right time is often not only great for patients, it is also better value for taxpayers. And that's why I'll be reforming the Better Care Fund to make sure that we make good use of NHS and social care budgets together to get people out of hospital as quickly as possible, freeing up vital bed capacity for others.
Paul Burns.
Thank you, Mr. Speaker. I congratulate the Secretary of State in taking community diagnostic hubs and expanding their hours, something which the last Conservative government established. But would he be able to outline what impact that will have on his workforce plan and expand on that, and whether the unions have accepted those not excessive by any stretch, but those extra hours that he's proposed in the announcement today? And will he have a serious conversation with me, please, about Fareham Community Hospital, which does have space for a community diagnostic centre and be very welcomed by my constituents in Hamble Valley?
Persistence pays off, Mr. Speaker. I'd be happy to receive representations from the honourable member about his own local hospital and the potential to provide more community diagnostics. In terms of the workforce, we found when we were consulting on this in opposition a real willingness on the part of NHS staff to put in the extra hours, so long as they're fairly remunerated, which they will be, and I'm grateful for the investment the Chancellor has provided to enable us to do that. NHS staff want to see progress to beat the backlog. They are as frustrated as anyone else and demoralised actually at work seeing people waiting for so long. So I've no doubt about their willingness to assist, and I'm looking forward to working with NHS staff across the country so that we can all feel that together we are delivering and improving NHS.
To help the situation, we're going to finish about 10 to, so it will help each other speed as we go. Rachael Maskell.
Thank you, Mr. Speaker, and I thank the NHS staff for working under severe duress over this winter time. One way of ensuring that there are better patient flows is to have better rehabilitation. So could my honourable friend say what he's doing to improve rehabilitation access, not only in acute sectors, but also out in the community?
I'm grateful to my honourable friend, and further to the previous question, we will be refreshing and updating the NHS workforce plan alongside the long-term plan that we'll publish in May, and my honourable friend is absolutely right. Rehab is key, not just to good recovery, but prevention of future demand on the NHS too, and I saw a great example of that rehabilitation delivered in social care settings only last week. So whether it's in the NHS or in social care, we definitely need to do more on rehabilitation, because rehabilitation is often secondary prevention.
Are there Chowns?
Thank you very much, Mr. Speaker. I agree with the Secretary of State that community-based services are crucially important. As it happens, my local NHS Trust contacted me in the week before Christmas about Hereford Community Diagnostic Centre. It's currently in the process of being built, but they were told to be ambitious with this project, but they were told in December that only 1/6 of the funding they need is available to them. So will today's announcement mean that the government will fully fund Hereford Community Diagnostic Centre?
I'm grateful to the honourable member for her question. We will certainly write her with further information about Hereford CDC, and just to say to her and other honourable and right honourable members, when it comes to capital investment, we were very pleased with what the Chancellor was able to deliver in the budget. We recognise that the stop-start we saw on a number of capital programmes under our predecessors was frustrating. We're determined not to repeat that, and that's why we are setting out clear and consistent proposals for capital investment in the NHS.
Siobhain McDonagh.
Mr. Speaker, last summer we celebrated the 25th anniversary of the Elective Orthopaedic Centre in South West London. The driving force behind that was Professor Richard Field, who came to my surgery every week after the election in 1997. Together with the help of the Prime Minister Tony Blair and the late Health Secretary Frank Dobson, he made it real. Lowest blood rate for hip and knee replacements, shortest stay and lowest levels of infection. Would he congratulate Professor Richard Field and be sure that his elective hubs are the way to cut waiting lists?
Can I warmly congratulate Professor Richard Field for his clinical leadership, which has made the difference to countless lives, not just in her part of London, but also because of the national example it set that many others followed. It confirms my strong convictions that the best innovations will come from great clinicians, and it's our determination to make sure that senior leadership in the NHS and in the government back great clinical leadership and innovation and take the best of the NHS to the rest of the NHS.
Graham Stewart.
Thank you, Madam Deputy Speaker. The Secretary of State said in his statement that 12,500 patients had to stay in the hospital beds because of a lack of social care, and yet we have it kicked down the road once again. So can the Secretary of State tell us, what can Louise Casey tell us that we don't already know about the tough political trade-offs that have led successive governments to fail to create that truly coherent health and social care system, and tell us what he can do to make sure that we meet the needs that are there now, today, as he already exemplified in November.
Once again, Madam Deputy Speaker, it's like the arsonist complaining that the fire brigade isn't doing a quick enough job. We're a bit sick of it on this side of the House, but we are at least rolling our sleeves up, getting on with the job, making improvements, and that's what we'll continue to do. The final thing I'd say, Madam Deputy Speaker, I heard the same complaints about Darcy. What can Darcy tell us that we didn't already know? Quite a lot, actually, and they should hang their heads in shame for it.
Nadia Whittam.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for his clear commitment to action on this. There are 131,000 vacancies in the social care sector, and low wages are the prime culprits. Last year, Unison found that 3/4 of care staff who do home visits also continue not to be paid for journey times between these appointments. So will my right honourable friend commit to ensuring both a £15 an hour minimum wage in the social care sector and for paid travel time to become a contractual requirement?
Thank you, Madam Speaker. I thank my honourable friend for a question. I'm a proud member of Unison, and I'm very proud of the work that Unison does standing up for its workforce in the social care sector. She is absolutely right, as is Unison, to argue that that fair pay is essential to recruitment and retention. That's why I'm delighted the Deputy Prime Minister included fair pay agreements in the Employment Rights Bill in the first 100 days, and I'm looking forward to working with Unison, GMB and others to negotiate the first ever fair pay agreements for care workers, care professionals in this country.
Alison Bennett.
Thank you, Madam Deputy Speaker. I would very much appreciate it if the Secretary of State could unpack a phrase in his statement where he said that where we can treat working people faster, we will. I feel that this phrase is ripe for misinterpretation. Please could the Secretary of State explain what that means? Does it mean stay-at-home mums waiting for an appointment? Does it mean carers, family carers, 26% of whom are on waiting lists? Thank you.
It does, Madam Deputy Speaker. I think in the context of I was referring to in the statement, I was talking about the fact that working class people are so often left behind in a two-tier system where those who can afford it are paying to go private and those who can't are being left behind. It's the determination of this government to bring back to life that essential Bevanite principle of an NHS that's there for everyone when they need it, healthcare available to all on the basis of need, not ability to pay.
Select Committee Member Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. I welcome this committee that will hopefully lead to some certainty on the future of social care. But with a 2023 National Audit Office report finding that 17% of local authority directors of social services being concerned about their ability to meet statutory obligations last year and a further 18% concerned about their ability this year, I do have concerns over what will be done to fix the immediate crisis in social care. Can my honourable friend therefore please outline what he will be doing to guarantee the sustainability of our care system now while we await further structural reforms that we dearly need?
Secretary of State.
I'm grateful to my honourable friend for that question. That's why the Chancellor in the budget delivered a big uplift in the spending power of local authorities, £880 million ring-fenced specifically for social care. And, of course, we are delivering through measures like the Disabled Facilities Grant 2 to deal immediately with the pressures. It's no good the honourable member opposite complaining. He voted against the investment, so he can't well complain about it.
Dr Andrew Morrison.
Thank you, Madam Deputy Speaker. The previous Labour government did a hatchet job on community hospitals, including in Wiltshire, with consequent uptick in the amount of delayed discharges in the acute sector, notably Bath, Salisbury and the Great Western in Swindon. Will the Casey Commission look at that and find ways of unpicking the damage that was done?
State.
Mr Speaker and Madam Deputy Speaker, the last Labour government delivered the shortest waiting times and the highest patient satisfaction in history.
Dr Peter Prinsley.
Madam Deputy Speaker, thank you. There are very worrying reports of cash-strapped universities reducing clinical academics. Indeed, some of them are being made redundant at a time when there's an increased demand for doctors. Does the Secretary of State agree that this is an extremely concerning development?
Thank you, Madam Deputy Speaker. Clinical academics have a very important role to play in the National Health Service and innovation in medicine. I know my right honourable friend, the Secretary of State for Education, is focused on the finances of universities. I also think universities should make sure they are prioritising efficiently and effectively, making best use of the resources available to them. I would gently say that universities haven't struggled as much as other parts of the public sector in the last 14 years.
After 14 years of austerity, the NHS has been starved of resources it badly needs. 4 months ago, the Secretary of State for Wales made a big announcement about cross-border NHS partnership to tackle the waiting list. The First Minister of Wales later poured cold water on the idea, and today's plan for England does not mention Wales. Was this so-called partnership ever real, or was it just another empty promise?
Of course, by definition, Madam Deputy Speaker, an elective recovery plan for England does not include Wales. However, I can assure the honourable member that we have a great working relationship with Jeremy Miles, the Minister for Health in the Welsh Government, with the First Minister herself. And not only are we providing support to the Welsh Government on elective reform to help them cut waiting lists, waiting times, we are also receiving advice from the Welsh Government on areas where health and social care services are doing better than England. Together, we'll create a rising tide that lifts all ships across the UK.
Joe White.
Thank you, Madam Deputy Speaker. Bassett Law has an increasingly older population, with 22% now over the age of 65. As the needs of my constituents change, I welcome the £198,000 additional funding for local disabled facilities grants. Does the Secretary of State agree with me that it is vital to shift care out of our hospitals and into our community?
I'm so grateful to my honourable friend for her question and for championing this particular issue since she arrived in the House 6 months ago. The Disabled Facilities Grant isn't just new handrails, new ramps, new accessible kitchens, new accessible bathrooms and home adaptations. It is freedom, it is independence, it is dignity, it is happiness, and it is really good investment in preventing demand on other health and care services by giving people their own independence and happiness back.
Dame Harriet Baldwin.
Thank you, Madam Deputy Speaker. And constituents in West Worcestershire will welcome the opportunity to get more services delivered through their GP surgeries, many excellent ones in West Worcestershire, and also through community hospitals. And yet I hear from those very same GP surgeries their concerns about the national insurance rise and how that's leading them to think about reducing services. And I just wondered when the Secretary of State is going to be able to square that circle.
Madam Deputy Speaker, I appreciate it was just before Christmas, but I wanted to get the certainty out to general practitioners before we all went off for Christmas. We did announce the biggest uplift in funding for general practice for some considerable number of years just before Christmas. We will now negotiate the contract in the usual way, but that should give them the stability, the certainty to know that this government is determined to fix the front door to the NHS. The other thing I would just say to the party opposite, they cannot continue to welcome the investment while opposing the means of raising it, unless they spell out which services would they cut or which other taxes would they increase. They haven't got an answer, they haven't got a leg to stand on.
Matt Rodder.
Thank you, Madam Deputy Speaker. May I warmly welcome the Secretary of State's statement today and also his emphasis on investments and reform. Could he say a little bit more about the important role of training for staff and also investments in new technology such as AI to speed up diagnostics?
State.
Madam Deputy Speaker, I think of the many great possibilities and opportunities facing this country are our strengths in life sciences and medical technology. And if we can combine the strength of our scientific and technological base with the ingenuity, care of NHS staff and our ability to deliver at scale with the model that was designed in 1948 that is actually well served to take us well into the 21st century, then the sky's the limit in terms of what we can achieve, and we will have to support staff through that revolution. I appreciate that for many staff working in the NHS today, they'd be grateful if the machine simply turned on when they turned up for work.
Sarah Dyke.
Deputy Speaker, I'm concerned about the lengthy timescale set out in the social care review, with the second phase not due to report until 2028. The care system is broken and it particularly affects rural areas like Glastonbury and Somerton. For example, a resident in Castle Carey, a 105-year-old D-Day veteran, is facing moving care homes due to high care costs. And this will have a negative impact on his health, his well-being and his quality of life. So what actions will the Minister take in the near term to reform the social care sector and provide older people with the dignity they deserve?
I'm very grateful for that question for two reasons. Firstly, because it gives me the chance to once again say the first part of the Casey Commission will be reporting next year so that we can set out a whole range of further actions that will be needed throughout this Parliament. We've taken a great number of actions already in the first 6 months. I dare say there'll be more to follow in the next 12 months. I must say it is, I think, very encouraging that one of the things we are hearing from across the House on the Casey Commission overall is go faster. I think that shows there is genuine cross-party appetite on this issue, and that is a really good place to start.
Stella Creasy.
Thank you, Madam Deputy Secretary. May I be the first person to wish you a Happy New Year on behalf of the House. I welcome the members I have to say. I welcome the Secretary of State's commitment to tackling the backlog of appointments. I think all our constituents would benefit that, and also his honest recognition that there is a risk, because there aren't two separate workforces, that unless we have sensible safeguards, we could end up paying the same NHS doctors more to do operations in the private sector. Now, the Secretary of State for Education has set a cap on the profits that can be made in the care sector of children's care. Is the Secretary of State considering a similar cap to protect the NHS and ensure value for money in his work with the independent sector in the NHS?
Secretary of State.
I'm grateful to that question. I'm not sure the level of exploitation that we see either in independent healthcare or adult social care mirrors what we have seen disgracefully in children's social care, but we do keep a sharp eye on this, and in particular remind my honourable friend of the commitments we made in opposition, particularly around tackling some of the excesses and worst kind of behaviour of some of the private equity-owned care homes who are leeching money out of the system. We will not tolerate that. We will act to regulate further, and I hope that provides members across the House that we are taking a both principled and pragmatic approach to the relationship we want to build, a constructive and positive relationship we want to build with the independent sector as we rebuild our National Health Service and build a national care service we can be proud of.
John Glenn.
Thank you, Madam Deputy Speaker. I would love to see a consensus evolve on social care, and I welcome Secretary of State's appointment of Louise Casey and the talk of the balance between individual, family and the state. But in every fiscal event that I was part of in the Treasury, more money was put into the NHS. I would respectfully ask the Secretary of State, what does he say about wide variance in performance across the NHS? And secondly, what does he say about consumption patterns? I understand his emphasis on the Deliveroo concept, but we have got to come to terms with the fact that most GPs would say that they do have excessive demand from people that don't really need to come and see their GP. A delicate and difficult subject to grasp, but one that we really must collectively in this place.
Secretary of State.
I'm really grateful for that thoughtful question. I think I would say two things to the honourable gentleman. Firstly, in terms of the wider fiscal pressures on the Chancellor, if I think it's difficult enough managing different choices and trade-offs between different parts of health and social care and the competing challenge I get from across the House on all sides of the House, I'm always grateful that I'm not the Chancellor of the Exchequer who's having to balance demands from the NHS alongside education the rising welfare bill, rising child poverty, the threats to our nation. So there are enormous challenges, and that's why I'm determined to make sure that every penny that goes into the health service is money well spent. My second responsibility, as well as making sure that patients get treated in the right time, in the right place, in the right way, is to make sure that we have a sustainable healthcare system with reduced demand by making sure we're doing more on the prevention side so we can keep people out of hospital, not needing to knock on the door of their GP surgery, not achieving the frequent flyer status that so many people in the NHS achieve. It's the one frequent flyer status they do not aspire to. We will only be able to deal with this if we do health service reform and public health reform. And on the latter, I'd really like to build a cross-party consensus on that issue too.
Very lengthy answer. Thank you. Nessa Charles-Khan.
Thank you very much, Madam Deputy Speaker. Just before Christmas, I had the opportunity to meet with some care workers in my constituency of Barking who told me about the day-to-day work they do supporting the most vulnerable people in our community. Does the Secretary of State agree with me that just as access to GPs helps relieve pressure on our hospitals and A&E departments, adequate adult social care and workers help to relieve the pressure on our GP services that are also having to deal with huge demand?
I wholeheartedly agree with my honourable friend who's done much to bang the drum on this issue in the last 6 months that she's been a member of this House. That's why we are taking a systematic approach to health and social care reform.
Seamus Logan.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for advance sight of his statement and also for writing to my party leader. I'm sure the Scottish Government will give full cooperation and engagement with Baroness Casey as she does her work. But in this statement you speak of failure. One of the failures, the elephant in the room actually, are the labour shortages that the NHS and social care are experiencing as a result of Brexit. Now, I'm asking you not to pass the buck, but to tell me what steps you're going to take in consultation with Cabinet colleagues to address these labour shortages through making it easier for migrant workers to come to this country and fill these vacancies.
Secretary of State.
I'm grateful to the honourable member for his question. We had a referendum and 2 subsequent general elections on the issue of Brexit. I can tell the honourable gentleman that neither of those 3 democratic events went the way that I wanted. And as a result, as we said to people at the time, the country chose a different path that would have consequences and implications. We do have a constructive working relationship with our friends and allies in the European Union, and you know, we can't change the past, but we can build a new partnership and a brighter future for our country.
Eric Twigg.
Thank you, Madam Deputy Speaker. My honourable friend will know that the large number of elderly people are admitted through A&E into hospital with respiratory conditions. Can I ask him what plans he has to strengthen the community respiratory teams who do a lot of good work and can do actually more work if they have the resources in preventing admission, but certainly preventing readmission?
My honourable friend is absolutely right, and that's why the vaccination campaign this winter has been so important, but he's right about the importance of community-based teams. One of the Darcy conclusions was that we'd increased significantly since 2019 staffing in our hospitals, but as a result of the wrong people in the wrong place, we've ended up with falling productivity in hospitals when actually what we need to deliver is a shift out of hospital into the community, and that's what our 10-year plan will deliver.
Jeremy Corbyn.
Deputy Speaker, most of the residential social care in England is delivered by the private sector. Is the Secretary of State able to give necessary resources to local authorities to reopen or open new residential care facilities, which are obviously so desperately needed? And that in the review Baroness Casey is undertaking, the public sector will be the primary objective for the delivery of a national care service, not through a privatised service?
I thank the right honourable member for his question. Thanks to the decisions the Chancellor took at the budget, we are boosting significantly the spending power of local authorities, and £880 million ring-fenced specifically for social care. I appreciate that a single budget can't undo 14 years of Conservative failure, but it's an important start. And of course, we want to see year-on-year improvement in the delivery of social care. Baroness Casey will be considering all of these issues and how we can improve ease of access and care quality across the public and private sectors as she undertakes her work.
Calvin Bailey.
Deputy Speaker, I strongly welcome the Government's action to help my constituents in Leighton and Wanstead get the care they need faster. Our local hospital, Whipps Cross, continues to struggle despite the hard work of its staff and leaders, NHS workers and carers who continue to provide service to our community throughout the Christmas period. In November, 36% of patients at Whipps waited more than 4 hours for emergency care, and recent weeks have seen this increase to up to 16% waiting longer than 12 hours. Does my right honourable friend agree with me that this welcome package of long-term reforms will address both elective care and emergency care for our constituents by moving effort from hospital to the community?
My honourable friend is absolutely right about that, and in improving the service for his constituents at Whipps Cross Hospital, that will also have the added benefit of improving the service for my constituents at Whipps Cross Hospital too.
Rebecca Smith.
Thank you, Madam Deputy Speaker. What's missing from today's announcement is any sort of update on the new hospital programme review, which in my constituency of South West Devon is vital because Herefordshire Hospital needs its urgent and emergency care centre to bring down its ambulance waiting service times before it even starts to tackle its general waiting list issues as well. So when will Herefordshire Hospital hear whether they are successful in your new hospitals programme review?
I was grateful to staff at the Hereford Hospital for showing me firsthand the emergency department pressures when I visited just before Christmas. I've also seen Hereford's pressures at the height of summer as well, where they experience high pressures. It is year-round difficulty at Hereford, and I thank the staff and leadership of the hospital for what they're doing against difficult circumstances. We will be coming forward shortly on the timetable for the new hospitals programme. I expect that will be published sooner than the Conservatives apologise for their appalling record.
Debbie Abrahams.
Thank you, Madam Deputy Speaker. I welcome the statement my right honourable friend has provided, but can he expand a little bit more on the new agreement with the private sector? He mentioned that the surgical hubs, for example, will be delivered solely by the private sector, but what arrangements would there be for emergency care when the occasion arises?
I'm grateful to my honourable friend. In terms of new capacity announced in the elective reform plan today, some of that is through the independent sector, some of that is new capacity within the NHS too. It's our ambition to rebuild the NHS so it's available for everyone where they need it, when they need it. We will be working with the independent sector. We're publishing full details of our independent sector agreement so that people can see the deal that we have reached and the sensible and effective partnership, including safeguards and protections that we've come to, and I'm looking forward to working with them to make sure that everyone, whatever their income and background, can get faster access to care.
Gary Williamson.
Thank you, Madam Deputy Speaker. When the Casey Review reports and if its recommendations are implemented, it's going to have a significant impact on local government. As the Secretary of State will be aware, large parts of the country are going through a process of local government reorganisation, and the outcomes of the KC review will have an impact as to what is the right reorganisation for those areas. So in using that sort of Blairite old phrase of joined-up government, isn't there any way in the best interest of joined-up government of bringing this forward more rapidly so the best choices can be made locally for local government reorganisation?
I can definitely reassure the right honourable gentleman that the Deputy Prime Minister and I are working very closely on this issue, which is very close to her heart and where she has a huge amount of experience. And of course, as the Deputy Prime Minister is embarking on her local government reforms, we'll be following that progress. So as Baroness Casey is looking at what the long-term future for social care will look like, she'll take into account those reforms. And once again, I note the exhortation to go faster.
Clive Efford.
Madam Deputy Speaker, one of the things that GPs say to me when I raise concerns about GP appointments with them is that they have difficulty in recruiting to posts within their practices. There's too few newly qualified doctors choose general practice as their profession. What can we do to put those doctors in place if we're going to make the community diagnostics and the basis of diagnostics in the community work?
And that's an excellent question from my honourable friend. I hope that within the first 6 months of this government, we have, from the first few weeks of putting in place the funding to employ 1,000 more GPs onto the front line before April, as well as the significant uplift we announced just before Christmas for general practice, we are sending a strong message to people who aspire to long careers in medicine, that general practice has a huge role to play in the NHS in the 21st century. It is an exciting place to be, but I recognise we've got to fix the front door to the NHS to make it more attractive. And the situation's even worse than my honourable friend describes, because as the party opposite left government, there were actually qualified GPs unable to find jobs at the same time as patients were unable to find GPs. That's an issue we've got to work on within weeks of taking office, and where we'll do more over the next 12 months too.
Final question, Jim Shannon.
Thank you, Madam Deputy Speaker. It's good to hear of the latest announcements to overhaul increasingly costly care for older and disabled people. Very much welcome what the Secretary of State has said. I understand that this will be undertaken under a 3-year review, and we will be clear on the plan to introduce this in 2028. Health has devolved in Northern Ireland, but there are thousands of care packages in Northern Ireland not fulfilled. What can the Secretary of State do to assist Northern Ireland to achieve the goals that are set here for England and the United Kingdom and need to be in place for Northern Ireland as well? Thanks so much.
Madam Deputy Speaker, I and the Ministerial team have already enjoyed in the last 6 months working with our counterparts in the devolved governments. We will continue to do that, and of course thanks to the decisions the Chancellor took in the budget, not only are we seeing a significant investment in health and care services here in England, thanks to the Barnett consequentials, that creates a rising tide to lift all ships across England, Wales and Scotland. I might even say all roads lead to Westminster, and I say to SNP colleagues, down that road from Westminster leads the resources for the SNP government, so they don't have the excuses not to act.
I'm sorry we couldn't go with everybody, and I tried to go as fast as I could, but those names have been noted. I'll give the front bench a few moments to swap over for the next statement.